on yeah. Fine. Right. Good evening, everyone. So this is our question answer session for today's webinar on year kilowatts in relation to year. So we have a question from Dr. Gulreis to know about elaborate the intralesional pharmacotherapy cocktail and dosage and frequency. Fine. When you do an intralesional pharmacotherapy, usually you can either combine with your cryotherapy or you can do it post operating. And now can I share a slide? Is it possible? Okay, fine. This is with regard to yeah. Yes. Okay. Fine. I'm doing that. Fine. Yeah. Now you can get me to the. My this is something, right? Fine. So this is with regard to the yeah. So right. So when you have the intralesional pharmacotherapy, you can either use your triamcinolone alone, that is 40 milligram per ml directly as an intralesional, or you can have a combination of triamcinolone along with 5-fluorouracil. But what you use is like you use a few 50 milligram, around 9 parts, around 0.1 ml of 0.9 ml of 5-fluorouracil, and to which one part, that 0.1 ml of triamcinolone is added. This is as per the published data. You can also use a little on higher concentration steroid, also maybe 8:2 also. And there is something called triple combination. What you have is like this is what they've used is like they add in around 0.6 ml of 5-fluorouracil along with around 0.4 ml of triamcinolone, which is 40 milligram per ml. So to this particular injection is added into a lyophilized powder of hyaluronidase of 1,500 units, and all three things are mixed well, and then further it is injected. So these are the three different commonly used intralesional pharmacotherapy. Now back to the screen. Yeah. So now coming to, so that's with regard to the intralesional pharmacotherapy. This is the dosage schedule as the recommended dosage schedule. So that's fine. There's another, yeah. Dr. Rajesh Rajagopalam wants to know with regard to silicone gel sheets, which has to be, when to change and how to use it. Fine. The silicone gel sheets are freely available in the market with different thickness also, depending upon the areas. You need to use a bit thicker one, maybe around zero point 0.3, zero point 0.4 millimeter when you're using over your chest and stubborn areas. And for your ears, as well as the rest of the areas of the face, you can use something little more thinner ones. So you can ask the patient to wash the sheets every week or every maybe twice a week and reuse it. And whenever they keep it, they can again stick it to the same package which it comes with. And usually it can be used for about 2 to 3 months time if it is not torn. If it gets torn, if it gets torn, you need to change it again. So this is how we usually use it because collagen sheet. I mean these silicone gel sheets are a little expensive. We have another question from Dr. Rajesh is on how to treat keloid infection. So basically, infection in keloids usually it is due to the sebaceous cyst or when there is an epidermal cyst or when there is a hair growing through which the ingrowing on the tricholamel sort of a cyst which is falling, which will invariably become a sinus and multiple discharging sinuses are being formed. So basically, you need to also treat this particular part. If there is what exactly is the reason for the infection? If there is something like the hair follicles are there, or if there is some sebaceous cyst, so you need to try to treat that part. The best way to treat the uh, hair inside the uh, keloid is to treat it with hair removing lasers like the diode lasers. You can also put mild drainages so that you drain the thing as well as you remove those hairs along with there are a lot of hairs which is worn inside the keloid tissue. You can do that, and further definitely you can always treat it with a course of antibiotic and anti-inflammatory along with that. There's another question on when to restart intralesional therapy after treatment of secondary infection. Immediately after you have the infection is subsided, you feel that the infection is completely subsided, you can definitely go ahead with that. There is another school of thought, immediately post surgical treatment, you can directly do a intralesional pharmacotherapy with the combinations also. How to relieve the pain during the intralesional injection? This is a very good question. This is like, as per the literature, around more than 60% of the patients do. I mean, there is around 0.33, around 33% of the people on intralesional therapy stop it because of the pain. So this is as per some of the literatures. So pain is one of the issue when you do your intralesional therapy. The best way for localized keloid, when you think of your earlobe keloids, when you think about your chest keloid, you can give uh, anesthetic block first, and further after once the block is given and to make sure that the block acts, and further you go ahead with your intralesional pharmacotherapy so that there is no pain. Another option is that you can also use cold, like a cryo helps to certain extent to relieve a bit of pain. You can use vibratory therapy. There are vibrating therapy mechanisms which we use it for pain relief when you do your injections for PRP and thing. You can use the same thing. And there is something new which is in publication. I would like to share that. Can I share my slide? Yes. Yeah. This is, yeah. Uh, Fine. Right. This is something that this is a recent publication which came last year. This is something called drug eluting dissolving microneedles. These are micro needles which is made of hyaluronic acid, and these are the ones you could see the picture here. These are the micro needles. Here there is these needles are around 600 micron in height and arranged into 14 into 14 arrays. And triamcinolone acetonide is embedded into 50% of the microneedles. from the sharp end. So in this particular study, they found that the microneedle penetrate the stratum corneum and stimulating the pain transmitting nerve fibers so that the pain is very minimal, and the drug and the vaccine delivery and the interstitial fluid extraction and cosmetic applications such as skin rejuvenation and scars. And this is minimally painful, safe, and can even be self-administered. And as per the publication, we could see that this excellent improvement at the end of 4 weeks in this particular keloid. So this might be something like we need something new to come into. So this is something new on reducing the pain and getting your transepidermal delivery of the drug into the core of the keloid. Yes. Fine. So that's about with pain, treating the pain. And yeah, there's another question. Yeah, there is Anamika Chowdhury asked that she had done a earlobe surgery, keloidal surgery 3 times to the same patient, and still it recurs. Fine. See, the issue when you do surgery on keloids is like you have to close your injury with least tension. There should not be any tension over that. Either you can use a complete core extirpation followed by a fillet flap, simple flap, or you can use an intramarginal keloid therapy. Even though you call it the intramarginal keloid therapy is a little better, the problem is that even that small left out the keloidal margin can induce some amount of aggravation. So maybe whatever you do, you need to close it the best possible, uh, least tension suture lines. And further, immediately after, you can start on intralesional pharmacotherapy as well as uh, uh, silicone gel along with pressure devices. So best thing is that if you don't use your pressure device, this is going to happen. You need to continue with your pressure device for about 6 months. And if there is a tendency to recur, if you feel that you always combine with your intralesional pharmacotherapy, preferably with your 5-fluorouracil and triamcinolone. And if it is not, then you don't really have to. Many of my cases which I've showed, we haven't used any intralesional drugs post surgery, but we have used the silicone gel and the compression in all our cases. So coming to which spinal needle, yeah, spinal needles definitely you can use a 18 gauge spinal needle. You also get 16 gauge. So 18 gauge needles would be more than sufficient. And you can, it all depends on the size of the keloid. If it's a larger keloid, you need a larger one. And make sure that the needle passes through the core of the keloid and it goes to the other side. And you have to pass in the liquid nitrogen from one end to the other end. If surgery cannot be done on earlobe keloid, then what is the next best option on the earlobe keloid? Definitely, it's your intralesional injections. You can use either an intralesional pharmacotherapy combined with the intralesional cryotherapy. If it's a very large keloid, if it's a smaller keloid, you can definitely treat it with your compressions and your intralesional therapy. Yeah. So some of the yeah, it's here. Yeah, there's a question on the role of ketotifen, vitamin E, phenytoin. So there are various agents because keloid is one place where so many treatment options have been tried, but none of them really work. So, for example, these are some of the agents, which is mostly when you have a topical therapies or intralesional therapies. Most of these things, mm, I don't think there is sufficient data to say that this can be used as a primary treatment options. Even the intralesional therapy with your bleomycin, there are few papers, and few papers say that the necrosis due to bleomycin is much higher than when you compare it with your 5-fluorouracil, and 5-fluorouracil is much safer when compared with your bleomycin. So these are the things. Uh, Somebody has asked for the Rustam has asked for the company selling delivery of the microneedles. The drug delivery microneedle. This is as per one of the pilot study which has been published. That particular study I have already quoted in the presentation which I showed you. So you can just use that, and in that this is Singapore-based company who has supplied that particular hyaluronic acid-based needles. Just go ahead. Search. Yes. Yeah. Sure then. Thank you. Let me just try. Can I share the slide? Yeah, so that I can give him the company who has come out with. Yeah, this is a Micropoint Singapore. This was a company which is hyaluronic acid microneedle from Micropoint Singapore. This is the company which had come out with this particular needles. All right. Another thing which I would like to emphasize is on the post surgical radiotherapy. Basically, the post surgical radiotherapy is one of the established, yeah, established treatment of keloid. It's one of the established treatment of the keloids post-surgically when there is stubborn, very large keloid which doesn't work with any of the modalities. Now, recently there is something like skin-directed uh, electron therapy, which is available, which is something like a office-based electron beam therapy, which can be tried in your office alone. So this is one new thing which has come, the radiotherapy becoming an office-based procedure in a dermatologist clinic. So post-surgical treatment, if there are very large keloid which is not amenable, which requires an electron beam therapy, usually what they use is around 30 centigrade of radiation in about 3 to 6 sessions. So this can immediately post-operative. So this can be done with this particular equipment. This is something new in the keloid management. Yeah. Exactly. Yeah. So this is the company. Just yeah. Okay. Okay. Let me just check it. Fine. So, okay. Fine. Right. Thank you, Rustam. That's fine. So there is Suthesh Chowdhury. Okay, fine. He wants to know that the same line of treatment may be effective for bony areas, sternal areas. So definitely, you can definitely do your similar treatment options for your bony areas also. As per the paper which was published, the particular treatment was done for a keloid over the umbilical area. So definitely, it can be done, and pain is almost 1%. That is as per the published data. Okay, okay, there is one. Okay, fine. So, Rustam, you have asked for a Delasco pressure hearing, how long to use it throughout the day. Basically, you're supposed to use any pressure devices for about 6 months, 3 to 6 months is the time, and ideally it's 6 months, depending upon the type of the keloid. If there's too much of activity, definitely you need to use it for 6 months. Otherwise, you use it for about 3 months and see whether there is any recurrence. Better to also keep in a small sheet of silicone gel so that it reduces the pain. Many people are not really comfortable with the Delasco pressure earrings, and it also comes with different shapes. Also, you get the heart shape, you have a flower shape, you have the round ones. A lot of different shapes are which are also available. So the best suited for the patient is has to be chosen, as well as you can also use a small layer of silicone gel sheet over that, so it softens the scar much better, and the pain part is also less when you use too much of pressure. Yeah, I think fine. Yeah, then we can close it. Sure. Okay, okay. Okay, fine. The basic issue with the keloid management is one of the major issues is the pain management that people have already asked about that. And the pain is something which you need to, because once the patient is not comfortable, it's very difficult to operate or you can do any of the surgical modalities or post-surgical your injection techniques also. So the new technique with your intralesional delivery might be something really hopeful. Let us hope for the best. Yeah. Yeah. Right. Sure. Right. So if there are no more questions, I think we are done with it. And thank you very much. If there's any further questions, there's one question over there. Yeah. Suthesh wants to know if there's any special treatment for multiple keloids following the acne. Definitely. See, acne keloidalis has to be dealt in a little different way than other keloids. Definitely, there are chances for more acne erupting and more keloids. So, best way to treat it medically is a low dose isotretinoin along with your regular keloidal treatment, along as well as the acne treatment. You give your acne treatment. On top of that, you can give your intralesional. Basically, your intralesional 5-fluorouracil plain is my choice because the steroids can again induce some amount of steroid induced acne also, or a very low dose of steroid with a higher dose of 5-fluorouracil combination can also be used. And uh, and you can also use pressure garments if there are too many, especially over the back and all. You can also use something like a pressure garments along with that. But ultimately, your acne management has to be completed along with that. And low dose isotretinoin is something which is tried along with that. So thank you very much. I think we have done well, and most of the question which was asked, I think I've answered most of the one, and we have gone mostly on a practical aspect rather than just a theoretical aspect. What we come across as clinicians and practitioners, and how you can deal with those uh, keloids at the best with the best possible facilities what you have in your even your peripheral settings. Thank you very much.